County Health Roadmaps 101 webinar. My name is Karen Odegaard, and I am a community coach with the County Health Roadmaps Project. My colleague Jan O'Neill is also here today, and together we're going to introduce you to the County Health Roadmaps Project. Before we get started, we want to take a moment to orient you to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Please feel free to enter your questions or comments in the control panel throughout the presentation, and we will answer any questions that we get toward the end of the webinar. If we don't get to your question during the webinar today, we will follow up with an email.
And also, this is Jan here. I want to let you all know that periodically we'll be posting links to tools and different interesting sites that we encourage you to explore during this webinar. So I will be posting right now a link to where the handouts will be.
Great. The County Health Roadmaps, our Rankings and Roadmaps program, is the result of the contributions of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute in Madison, Wisconsin, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. So here's our plan for the next hour. We'll start with our essential question for the webinar, provide a brief overview of the County Health Rankings, looking specifically at the model that underpins the rankings, and then we'll dive into the County Health Roadmaps, including a tour of the Action Center and what works for health. We'll leave time for your questions before we wrap up. It is our hope that as a result of today's presentation, you'll be able to identify at least one way your community can enhance your efforts to improve health. So we're going to start with a poll to learn more about the types of actions that you're currently or that you already have taken in your community. And we'll do this fairly quickly. We call these our rapid response polls, so we'll just take a little bit of time here and see where we're at.
Okay, so.
Great. We'll give it just a few more seconds. Great response rate from all of you. Thank you. And we're going to go ahead and close the poll now and take a look at your responses.
Oh, that's fantastic. Look how many have identified priority.
Oh, that's great.
That's 80% of the problem right there with many communities. The challenge is where do we focus? So that's fantastic.
I think also it's interesting at the end of the poll there, the option of evaluated progress. And I think this is something that we see often with communities is it's a challenge to figure out exactly what they should be evaluating, how to get that done, and how to work with their key stakeholders to do it. So that's interesting and I don't think all that unusual. So this is fantastic. So, and the other thing I think that's interesting here is that we see so many communities are already sharing their data with their communities. Yeah. So that's fantastic.
So it looks like they're moving from the data. We've done the data. Yeah. Now we're going to really demobilize and see what we can do around these actions and strategies. Right.
So this is a really great segue into talking about county health roadmaps. So our essential question for today is how can the County Health Roadmaps help us create a healthier community? And we have this photo here, this image here of a quilt where quilts are made up of several pieces of different fabric, different colors and different shapes. You know, most of them are interesting in their own right, but then they come together, they're sewed together to serve a common purpose. Similarly, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose to create a healthier nation, county by county. So as we discuss the various components that make up the County Health Roadmaps today, think about which piece or pieces of the Roadmaps project project you can use to create a healthier community.
So let's start first, though. I know most of you all are familiar with rankings, but just to give us a grounding in that, we'll do a very quick tour through county health rankings because that's the launching point for us here. If you've attended our webinars before, you've probably seen this logic model, which explains why we release the rankings every year. Our ultimate goal, of course, is to create a healthier nation county by county. What happens is the rankings released attract media attention, both nationally and locally, which gives you, as a community leader, an opportunity to use that attention to engage your community in action that will improve the health in your communities. It's really a leverage or a tool for you. And the bottom line is, why rank? It's all about a call to action. And the horizontal portion of this slide really underpins the whole rankings. The rankings, we rank the health of nearly every county in every state. And for each county in a state, you'll find two rankings. One is on health outcomes, and one is on health factors. So why two rankings? Because there's two sets of messages we want to convey. One set addresses how healthy a county currently is, like today's health, your today's health. The other addresses how healthy a county might be in the future, its potential, based on the many factors that influence health. So now let's take a look at the model underpinning these two rankings. Starting from the bottom, we believe that effective local, state, and federal policies and programs can improve a lot of factors that in turn shape the health of communities. And these many health factors shape a community's health outcomes. We specifically, and this is in the blue, look at health behaviors like clinical care, social and economic factors, and the physical environment and health behaviors. And we measure two types of health outcomes, which are in the green, to show how healthy a county is. How long people live, which is mortality, and how healthy people feel, which is morbidity. So here's an example. A clean indoor air policy is a policy that can influence health factors such as tobacco use, which in turn influences health outcomes. County Health Roadmaps is focused on the orange policies and programs part of this model. And we often point to this image as really one of our most important because it outlines what we use to determine the rankings and what influences health in a community. It also is a great visual for why it's so important for us to partner across multiple stakeholders with diverse sectors involved. A hospital, a public health department, our schools, no one sector can improve health outcomes alone. So when you go to our site, you'll see a map where you can click on your state and from there your county to find out how you rank this year. And for the past 3 years, you'll find data on 30 measures that we use to rank counties, as well as additional data that can be helpful to your community improvement work. And if you'd like to learn more about how to use the rankings data, you can check out an archived webinar on our site, which I'll put into the chat box next, unless you've done that already.
Sorry.
Okay, great. So now let's turn to the roadmap side of our site. Going back to our logic model, the roadmaps project fulfills the vertical section. Now that we have our community's intention, we want to find the best possible strategies, ones that have some evidence of effectiveness, to focus on our community's health priorities. And ultimately, by taking collective action using these effective strategies, over time, people in our community will be living longer, higher quality lives. This is a model that explains the why and the what behind county health rankings and roadmaps, but how do we do this? How do we take action? And that's where the take action cycle comes in. It's the how within county health roadmaps. It's a simple and straightforward process that communities follow to improve health. At its core are people working together because we know solving issues like poor high school graduation rates, excessive drinking, or inadequate access to health care, or even inadequate health care itself requires the wisdom and resources of people from all walks of life. And the basic steps in the cycle are to gather information, to set priorities, to find the most effective approaches to address your priorities, and then on the left-hand side of the cycle, do it. And of course, along the way, evaluate throughout so that you can improve your strategies and ensure that what you're doing is effective. So you'll also see that communicate sits in the center of the cycle as well. That's because communication with stakeholders is so essential throughout the Take Action cycle. There are 5 core principles that are the foundation of county health roadmaps. First, it takes everyone, all of us, working together to improve the health of the community. Second, we need to move as quickly as possible to the left side of the cycle, not get stuck in analysis paralysis or drowning in data. We need to move to action and evaluating our effectiveness, which we saw with the poll.
Yeah,
that's where folks are, which is great.
Fantastic.
And third, we don't need to reinvent the wheel. We should be looking to the evidence to inform our actions. And if we're going to innovate, be sure we evaluate. Fourth, keep focused across the health factors, including social and economic factors, which are 40% of the model. And fifth, finally, don't be afraid to take on policy, systems, and environmental change, which will, in the long run, create the deepest, longest range change for health for the children and adults in your community. As part of the Roadmaps project, we have some great national partners that can help you engage other partners and leaders locally. They were selected because they have proven track records of providing high-quality training and technical assistance, and they're committed to making communities healthier places to live, learn, work, and play. United Way Worldwide became a national partner in July of 2011, and the second partner grant was awarded to the National Business Coalition on Health in October of 2012. And then the third partner grant was awarded to the National Association of Counties, NACO, in January of this year. And there will be more partners announced as we go along. So now let's focus on that second principle, moving to the left side of the wheel, moving to action and evaluating your effectiveness. When you go to the Roadmaps homepage, you'll see the Take Action cycle and a link to the Action Center, which Karen will now take us on a live walkthrough.
Great. Thank you, Jan. Once you get to the Action Center, you can click on any step in the Take Action cycle to find guidance and tools for the various activities that make up that step. So I'm just giving you a quick example of what we're going to see, and then we're going to go right into the website to take a look at it. So for example, if we click on the Assess Needs and Resources section of the wheel here, then we move into our Assess Needs and Resources guide. Here we see the Assess Needs and Resources guide breaks this step down into 10 key activities, so you can find guidance and suggested tools for exactly where you are in your process. Each of our action steps is broken down in this way, so you can find key activities with brief guidance and suggested tools. So let's go to the website and take a look at how this actually works. From the homepage of our website, countyhealthrankings.org, you can click on the Roadmaps tab, which takes you into our Roadmaps to Health page. Here, we can click into the Action Cycle, or the Action Center, and there we see the Action Cycle again. So I'm going to walk you through an example of how a community might use the Action Center. And I'm not going to dig into every nook and cranny of the Action Center. There's a lot here, but basically what I want to do now is just demonstrate how to use the site. So I was recently talking with a community that wanted to get beyond the usual suspects and start to engage a variety of partners in their health improvement effort, which is exactly what we encourage folks to do in our Take Action cycle. And they were struggling with how to convince people in their business community that they should care about and participate in health improvement. So because this question was obviously about building their coalition, we started in the Work Together guide. So I'm going to click here and Work Together. And as I said, each of our guides are broken down into key activities. This is intended to help you be able to more easily find relevant guidance and tools. So we can look here and see the variety of activities that we have included here in Work Together. For this community, the first key activity made the most sense. Recruit diverse stakeholders from multiple sectors. So we'll click there, which takes us down into the guide to that specific key activity. Here we'll find some guidance about how to go about recruiting diverse stakeholders from multiple sectors and why that's important to do. And as I looked through this section with this community, this particular sentence stood out to us. If you want to recruit a new individual or organization to your coalition, effective recruitment of coalition members helps you analyze what's in it for them. So this is a tool that we've included in the Action Center in the Work Together guide. So we clicked on that tool. And this takes us to our database of tools and tells us a little bit about this particular tool. We know that from looking at this that it is a PDF, and then we've also got a brief description about what it is and the source. Here we can go ahead and click right on that tool, and it takes us into the tool itself, which is a 3-page PDF that provides a structure to help a community think about why members of in this community in particular, why members of their business community might be interested in health improvement. So you can see how a community came in, found where they were at with their key activity, went into that key activity, reviewed the guidance, and found a tool that was relevant to them. I'm going to back out of this now by just simply backing up, back to the Work Together guide. Now, from this key activity, I can either go down to the bottom here of this activity and click back to top, or I can just simply scroll right back up to the top of this page. A couple of other pieces I want to point out quickly. In each guide, you'll find, in addition to the key activities, you'll also find some highlighted tools up at the top of this page. And you can also download the guide as a PDF. Throughout the Action Center, or throughout the Action Center, you'll find this orange box that says Need Help. We encourage you to use that whenever you get to a point where you have a question about a tool, or you can't find a particular tool, you're not really sure what your next step is. This is a way to reach us here at the County Health Roadmaps program, and we can offer you some technical assistance. Another way to find helpful resources on our website is to go up here to this on the menu bar up at the top. You can click on Tools and Resources. So I'm going to go there. Here you can find tools categorized by type, action step, health factor, and roles. All of those are along that left navigation bar. So the other thing you can do is you can search our tools and resources using a keyword search. So if you remember after today's webinar that we had some kind of tool for recruitment, but you're not sure where it is, you can come in here and type recruitment. And you will see that we have 2 tools that speak directly to recruitment. I'm going to back out of that search. One other thing I want to show you while we're here is that we've recently started recording screencasts for some of our various tools. So you can click on screencasts under types. And here you'll find, so far we have 5 screencasts that provide a little more assistance and how-to on some of our tools that we have on our website. These are generally 5 minutes or less, and just can give you a brief orientation to how you might use the tool, perhaps with an example from a community who has used the tool.
Karen, could you just explain, we call them webcasts here actually.
Yeah.
What is the difference between a webcast, or what you call a screencast, and a webinar?
Sure. So we're calling these screencasts to delineate them from webinars. Right now you're on a webinar. This is usually about an hour-long event. The screencast is something that we do in-house. We don't have a live audience for it, and it's typically a limited number of slides and a limited amount of time to really just introduce a tool fairly quickly. Another way to learn that we hear often from communities that are looking to learn about what they can do is to learn from other communities. So people are often saying, can you give me an example of a community that has done this, or where can I find a community like myself? So we have provided on our Roadmaps to Health main page, so again, clicking on that Roadmaps tab, there is a drop-down menu here. What can I learn from others? So here you can learn more about our national partners. You can learn about the community grants, learn about what communities are doing to address social and economic factors. You can go to stories and read stories about communities that have taken action. And you can also look at our project showcase, which highlights innovative ways that people are using the county health rankings.
One thing I wanted to mention is that the project showcase where we have the calculator also. Yeah. We have that just for a couple of factors, but yeah, it's very cool.
So what Jan is talking about, we'll go into projects. And we'll go to Browse All Projects. And here we have our County Health Calculator. This is an app that helps communities see how affecting their education and their income and education, how that would impact their health outcomes. So you can get to that from our project showcase. It's a useful tool for communities who want to start to show why they want to work on income and education and how that's going to impact health in their community. So another useful thing on our website in the Action Center, and you all know about it already because you're on one of our webinars, but we do offer a number of webinars, all of which are archived on our site. And you can register for upcoming webinars or review past webinars here by clicking on the webinars, on our main menu bar up at the top of our page. So that's a fairly quick run through of our Action Center. And like I said, I didn't want to show you every nook and cranny of the Action Center, but hopefully you can see how to navigate within it.
And again, we've been posting links in the chat box there. For example, I just posted a link to where the archived webinars are, so be sure to check those links to see, to find out more.
Great. We were just talking about webinars. I want to draw your attention to the fact that we do have 3 series of webinars that have recently started and will be continuing throughout the year. 2 brand new series will focus on breaking down the rankings model and partnerships. And we will also be offering the Take Action webinar series again this year. So we regularly send out announcements about our upcoming webinars to e-newsletter subscribers. And if you haven't subscribed to our e-newsletter, now is a great time to do so. We'll have information at the end of our webinar about how to do that, but you can also do it right from our countyhealthrankings.org website. Also, I want to point out that thanks to the support of the Robert Wood Johnson Foundation, we do have 3 community coaches in the County Health Rankings and Roadmaps program, Jan and myself, and then Kate Konkle as well. We are able to provide assistance to you at no cost. So please don't hesitate to contact us if you need assistance with a tool, a question, or the next step in your process. So going back to the foundation of roadmaps, let's talk now about evidence-informed action. Why is evidence important? Well, first of all, using what has been shown to work can drive smart investments. None of us have a lot of time, money, or resources, so choosing strategies that have been shown to work can definitely help stretch your impact and stretch the scarce dollars and resources that you have. Also, knowing whether there are strategies that effectively address your community's priorities can help inform decisions about when to adopt existing strategies and when you might want to take a more innovative approach. And finally, it is important to understand that what has been shown to work and what hasn't worked when you're creating new solutions. So if you can consider what works, or considering what works can help you ensure that your innovative solutions are going to be effective. Thinking about what has worked and then trying to emulate those things in your new innovative solutions. What Works for Health on our website provides information to help communities select and implement evidence-informed policies and programs. In What Works for Health, we search out, summarize, and rate evidence for policies and programs that can affect health. We also provide examples of communities that have implemented these strategies, along with links to toolkits and other items to help you get started. So we're going to go back to the website now and walk through What Works for Health. So we're back on our website and back at the Roadmaps to Health page. And if we scroll down a little bit here, we can see the What Works for Health entry point. So I'm going to click there, and we're going to go right into What Works for Health. Again, I'm going to demonstrate how a community might use What Works for Health. If you're interested in digging deeper into What Works for Health, you'll find lots of additional information about our ratings, methods, and sources right here on the left navigation menu. You can also watch our 4-minute What Works for Health tutorial. So those can help you get more grounded in What Works for Health. For now, I want to, again, show you how a community might use What Works for Health. So there are 2 ways to find policies and programs. You can come in and you can do a keyword search here, or the most direct way to find strategies to address any particular health factor is to select that health factor from the far right-hand side of the model. So right now we're going to, for an example, select education. And this brings us to a list of all the strategies in the education health factor. Policies and programs with the strongest evidence appear first in our list. So we assign evidence ratings based on the quantity, the quality, and findings of relevant research. And we have 6 evidence ratings, with scientifically supported being the highest rating, and then evidence of ineffectiveness being the 6th rating. Just to orient you to what you see on this page, on the left here, you can see that there's a minus sign next to education. This lets us know that we're only looking at education strategies. We can also add additional filters, such as decision makers and evidence rating, to further refine our search. Another thing that you'll notice here is that some of the policies and programs span multiple health factors. So for example, looking at this 3rd program here, Comprehensive Early Childhood Development Programs, this program has strong evidence for outcomes that affect both education and community safety. So we're going to actually go into this program right now and take a look at what that page looks like. So first thing you see here is a short description of the strategy at the top of the page. To the left, you can see the rating indicated by the thermometer. And this program is scientifically supported. When we hover over the thermometer, we can see definitions of all 6 of our evidence ratings. So we can see here that scientifically supported means that this program works. There are a number of studies or systematic reviews that have had strong positive results, and there isn't any substantial contradictory evidence. Going down the page, we can see the expected beneficial outcomes, and then a summary of the evidence supporting the strategy. This summary is the real meat of our entries of policies and programs. Here we're going to share what we know about who a strategy works for and what it has been shown to accomplish. We're also going to provide the characteristics that make efforts successful, or sometimes, as you can see here, the names of specific tested programs. So here we can see, for example, Chicago Child Parent Centers and High Scope Perry program. These are some specific programs that have been tested. We also include any unanticipated benefits or consequences that are mentioned in the literature in this section, and when possible, information related to cost and cost effectiveness. And next you'll see the likely impact on disparities, and then implementation, examples, and resources. So here you'll find any toolkits, model language, or other information that can help you move forward. We also include the dates that our research was conducted, and you can scroll to other policies, related policies and programs in your health factor of interest here. Now to return to the full listing, you can click on the Browse button here, or scroll back up to the top of this page and use the breadcrumbs that we have up here at the top. And you'll see this type of treatment throughout our website, so you can often get back to where you started. We can go back to what works for health here. So how might you use what works for health? There's a couple of different things that what works can be particularly helpful for. First of all, learning about policies and programs to help you understand what you might do to address health factors in your community. You can also use what works to inventory your current approaches. Are the things that you're currently doing effective? And also you can use what works to choose the policies and programs that you want to implement. You can use what works to formulate an action strategy. I'm going to turn it back over to Jan now to talk about 2 more pieces of County Health Roadmaps.
Great job, Karen. We have lots of questions that came through, so
fantastic.
I've been trying to respond to them as we go along. I just wanted to say, if I didn't get to your question or if Karen didn't, we're going to have some Q&A coming up here very shortly, and so you can ask it during that time. Yeah. So 2 more parts to this. The Action Center and What Works for Health can help you align with the 5 principles that are foundational to County Health Roadmaps. And the Robert Wood Johnson Foundation also supports 30 communities that are adhering to these principles. And they're funded, these communities, to work on social economic health factors, specifically through working on adopting policy or systems changes that will really impact those focus areas. And we often feature these communities in our webinars. If you want to learn more about what they're working on, you can go to a link on our site, which Karen will put in the chat box again. The RWJ Foundation also wants to shine the light on those communities that are in alignment with these principles by awarding highly selective prizes in recognition of their good work and to elevate their work to a national stage so that all of the communities in our country can learn from them. So this was the first year the prizes were awarded, and 6 communities were selected. You can learn more about them by visiting the link on our site, which Karen will post again in the chat box, where you'll see videos and stories about their work. If you're considering applying, we want to encourage you to do that because there's still time applications are due May 23rd, and we encourage you to review the 6 community stories first, and then take a careful look at the prize criteria, and then work with others in your community to submit an application. I can say this, having done some follow-up after the prizes were given out, we talked with those communities that didn't get the prize, and every one of them said what a powerful process it was just going through the prize application. So we really encourage you to do that.